Hi, today I'm going to talk about Oxantel Pamoate Albendazole for Trichuria infection. Trichuria infection. It lives in the large intestine, and whipworm eggs are placed in the faces of infected persons. Then they can mature into a form that is infective. Whipworm infection is caused by ingesting eggs. This can happen when hands or fingers that have contaminated dirt and them are put in the mouth, or by consuming vegetables or fruits that have not been carefully cooked, washed, or peeled. In this video, we can see how the trichuria get in our intestine and put her eggs. People with light infection usually have no symptoms. People with heavy symptoms can experience frequent painful passage of a stool that contains a mixture of mucus, water, and blood. Rectal prolapse can also occur. Children with heavy infections can become severely anemic and growth retarded.
Whipworm infection is an infection of the large intestine with a type of roundworm. Whipworm infection is caused by the roundworm Trichuris trichuria. It is a common infection that mainly affects children. Children may become infected if they swallow soil contaminated with whipworm eggs. When the eggs hatch inside the body, the whipworm sticks inside the wall of the large intestine. Whipworm infection symptoms: bloody diarrhea, iron deficiency or anemia, fecal incontinence during sleep, rectal prolapse, exams and tests. Whipworm infection treatment: Albendazole taken by mouth for 3 days is commonly prescribed when the infection causes symptoms. Albendazole is used as an alternative therapy. Whipworm infection is a common disease, yet every individual needs unique treatment and care. We encourage people with whipworm infection and their families to learn as much as possible about the latest medical treatment and approaches, as well as healthy lifestyle choices. For more information about whipworm infection and how to treat whipworm infection, just click on the link at description or visit www.mainmd.com.
Oxantel Pamoate is more effective than other drugs at treating and reducing the infection burden of trichuria, without negatively affecting the efficacy of albendazole against hookworm and ascariasis. In this video, we can see a lot of trichurias in the mucus of the intestine. This is an infection of trichuria. Albendazole. Infection with soil transmitted ailments, Ascaris lumbricoides, hookworm, and trichuria are widespread and often occur concomitantly. These parasitic worm infections are typically treated with albendazole or mebendazole, but both drugs show low efficacy against Trichuris trichuria. Albendazole is the drug of choice against hookworm.
Our index case was a 15-year girl who presented with 6 months history of abdominal pain, diarrhea, and occasional hematochezia. She was becoming progressively pale over this period. Clinical examination revealed a grossly pale girl with no other physical findings. Laboratory tests revealed severe iron deficiency anemia. And stool analysis showed ovo Trichuris trichuria. A diagnosis of inflammatory bowel disease with severe anemia was entertained. She was planned for parenteral iron therapy and a colonoscopic examination. Video colonoscopic examination revealed carpeting of the entire colonic mucosa with thousands and thousands of Trichuris trichuria worms. The thick posterior segment of the worms was visible as curved structures of 1 to 2 centimeters. The anterior narrowed end of the worm, namely the whip, was embedded in the mucosa. Associated mucosal changes included petechial lesions, blotchy mucosal hemorrhages, and active mucosal oozing. The mucosal hemorrhages were seen at sites where the worm's anterior end had burrowed into the mucosa. Mucosa showed edema at the sites of heavy infection, which caused a lack of distensibility and luminal narrowing. There was no mucosal pliability, ulceration, cobblestoning, or polyps. These changes were well described in the still colonoscopic images as shown in this slide with 4 composite pictures. Colonoscopic forceps biopsy revealed posterior segment of a female adult Trichuris trichuria worm containing a gravid uterus with numerous Trichuris trichuria eggs. This forceps colonoscopic biopsy showed a gravid uterus of Trichuris trichuria worm loaded with characteristic eggs of the worm. Colonic mucosa showed increased lymphoplasmacytic infiltrate. There were no cryptitis, crypt abscesses, or mucosal ulcerations. Patient received parenteral iron therapy and effective antihelminthic therapy. She had rapid improvement in abdominal pain, diarrhea and hematochezia settled, and she showed improvement in her blood indices. A repeat colonoscopic examination at 6 weeks follow-up showed normal colonic mucosa, and repeat biopsies did not show any Trichuris trichuria worms or eggs. She stayed asymptomatic for 5 years in the follow-up. Our index case 2 was a 40-year female with iron deficiency anemia. She had Trichuris trichuria infection limited to the cecum and right colon. This video shows Trichuris trichuria worms actively moving in the cecum. The fact that anterior narrowed end of the worm, that is the whip, was embedded in the mucosa and could be extracted from the mucosa by holding and pulling on the posterior segment of the worm by forceps is shown in this video. Over a 3-year period, we detected 10 patients with Trichuris dysentery syndrome. All patients were adults and dominant presentation was progressive iron deficiency anemia. Worm invasion was limited to the right colon in 7 patients, ileum in 1 patient, left colon in 1 patient, and whole colon in 1 patient. Trichuris trichuria is a geohelminth inhabiting the human cecum and proximal large bowel. Over 1 billion persons harbor Trichuris trichuria infection, mostly in the preschool age children and school age children. The infection is mostly asymptomatic. There are few published case reports of Trichuris dysentery syndrome in children. The disease has not been reported in adults. Trichuris dysentery syndrome is caused when colonic mucosa is invaded by numerous worms. The disease causes mucoid diarrhea, rectal bleeding, rectal collapse, iron deficiency anemia, and finger clubbing. In addition, children with Trichuris dysentery syndrome may develop growth retardation and impaired mental development and cognitive functions. This presentation focuses on the fact that in endemic areas like Kashmir, Trichuris dysentery syndrome occurs in otherwise healthy adult population. Most of these patients present with iron deficiency anemia with minimal or no bowel symptoms. Colonoscopic findings are pathognomic as numerous organisms invade colonic mucosa regionally or all over. Trichuris dysentery syndrome should be considered in all patients in endemic areas with chronic iron deficiency anemia and or ocular blood loss.
Chronic Trichuria infection affects hundreds of millions of people, primarily children in warm, humid regions with poor sanitation. Treatment with Oxantel Pamoate or Albendazole result in higher cure and X reduction rates for Trichuria infection than the rates with standard therapy. I hope you will like this video about Trichuria infection. Bye!